call the first Speaker of the Opposition, Ariba Tariq.
Ladies and gentlemen, the proposition came forward today and proposed an amendment to the present healthcare system based on a need which comprises of undue pressure and a misallocation of resources. They mention how that under the present healthcare system, this private healthcare can only be afforded by the most elite, the most wealthy of individuals. Well, ladies and gentlemen, one thing the proposition forgot to speak about is how this policy will in fact benefit the American people. How this policy will in fact, how the effect this policy will be propagated to the American people, and whether in fact, in the long run, the entire populace will in fact be benefited. Ladies and gentlemen, first of all, coming along to this wealthy and elite class, I ask you first, ladies and gentlemen, whether they want to resort to private healthcare or state-funded healthcare. Since they are the wealthy, since they are the elite class, since they can't afford it, can't that be left up to their own discretion, up to their choice? Do not these people deserve the right to choose whether they want to resort to private healthcare or to state-funded healthcare? That is a question that I asked the proposition today. Furthermore, coming along, the proposition today mentioned repeatedly the poor condition of the present healthcare system. They mentioned again and again how adequate quality is not being achieved. Well, first of all, ladies and gentlemen, the burden of the government is to provide accessibility to adequate healthcare, ladies and gentlemen, accessibility. The burden of the government is to provide that option to that percentage of their populace to access the healthcare, but not to deliberately force it upon them. It is still upon the discretion and the choice of the populace which healthcare system they want to opt for. Now, furthermore, coming along, as I've mentioned, thank you, sir. As was mentioned in a POI, what are problems that exist with state-funded healthcare? First of all, like was mentioned by one of my speakers, there is a basic problem with the very fact that when you have waiting lists for healthcare systems, they do span 6 months long. That quality and accessibility is not even fully ensured in a system whereby the proposition proposes that complete healthcare will be covered by the government. The proposition came forward and proposed a policy which was elaborated upon, ladies and gentlemen, in the last 30 seconds of their speech, and only when their second speaker prompted their first speaker with tax, tax, tax. Exactly, ladies and gentlemen, tax, tax, tax. How are the American people being benefited? How are the American people who will be forced to bear the burden of this taxation to pay for this healthcare system benefit? How will the government ensure that they provide both complete coverage, complete quality, cover all clinics, all hospitals, all doctors, all physicians, and ladies and gentlemen, I almost forgot. The point about pharmaceutical companies implying undue pressure, no thank you sir, implying undue pressure. Ladies and gentlemen, these pharmaceutical companies are going to pressurize the doctors. They're going to pressurize them with and for these FDA-approved drugs. But in the day when that medicine reaches the patient, the fact of the matter is that it is helping them overcome their disease. It is helping them overcome their sickness, no matter which company or channel that medicine came from. No, thank you, sir. Now, moving along to my positive case. Now, ladies and gentlemen, when we look at the present status quo, we see that in America right now, majority of healthcare is being tackled by the private sector, and that the state-funded sector does exist. The policy that the opposition instead wants to put forward is that all individuals earning less than $30,000 a year will be automatically eligible for state-funded healthcare. And for individuals that are earning above this amount, the state-funded coverage is subject to the number of dependents they have and the examination of their recent financial records. Now, ladies and gentlemen, what does this policy basically achieve? What we're achieving is that, as the proposition mentioned, those people who are unable to afford adequate healthcare, who are unable to pay for this coverage, will in fact have the option of resorting to state-funded healthcare. But at the very same, we're also ensuring that those people who want to opt for private healthcare, who want to go for this private option, will not have that option removed for them. And I'll be arguing this along 3 lines of argument. Number 1, is there really a need for the government to interfere with the present system? Number 2, sustainability. Number 3, how this essentially weakens the private healthcare companies and its negative impact. And lastly, the last line of argument, which was dealt with my second speaker, the inefficiency of state-based healthcare. Now, coming along to my first line of argument. Ladies and gentlemen, is there really a need for the government to interfere? At present, we see that when that very same healthcare bill was proposed, 44% of the population was supporting it. What about the other 56%? What about the other 56% that indeed did not want to go for the state-funded option? What about the other 6% that wanted the government not to interfere and leave it up to the discretion whether they offer private or government-funded healthcare? Essentially, ladies and gentlemen, what happens when you have the government cover the entire healthcare system is that you are overburdening the government. The government which is already having to pay for education, the government which is still tackling with a recovering economy. Yes, their economy is still in the stages of recovery. When you have this additional burden of healthcare on the government, how can you ensure that quality will be maintained? How can you ensure that that level of quality will be maintained when the government is having to tackle an additional cost in addition to its already cumbersome burden? Furthermore, ladies and gentlemen, it has been shown that with this proposed healthcare bill, in the coming decade, America's debt will increase by $1 trillion. Can this economy actually afford it? Can the government actually afford to take this risk upon themselves? Yes, sir.
We already told you that through taxation and through the recruitment of funds through charitable institutions, we will have enough funds to not seek debt from outside.
Thank you, sir. I'm glad you brought up taxation. Although I was going to deal with that in my second line of argument, let's just jump to that right now. What happens to taxation, ladies and gentlemen? Once again, you are forcing the entire populace to pay for an option that they haven't even all opted for. You're forcing that 56% to go for state-funded healthcare when they do not even support the proposed bill. What happens to taxation is the government is levying a certain percentage of its costs onto the national population. Now, furthermore, ladies and gentlemen, coming along to the point of sustainability. Now, what happens with sustainability? When the government is covering the healthcare sector, what happens is that in the future, if the government ever goes through an economic crisis, if it hits a recession, yes, the recession won't hit in the near future, but it is a possibility. Considering present circumstances, it is a possibility. What happens then? Healthcare, which is a sector that cannot be compromised, will be compromised. What happens then? The government will be forced to undergo, no thank you sir, will be forced to cut back on the budget of the healthcare system. The quality of the system will inevitably be affected. The people who are covered, and in fact under the proposition's policy, the entire population which is covered by the healthcare system will be affected. You are reducing your healthcare system to a very factor. Yes sir.
We already told you how mandatory government spending is not curtailing these situations when there is recession, but in fact the main thing to be curtailed are excessive or discretionary spending.
Sir, you're proposing that in the case of economic crisis that the government will not have any sort of budget cuts. That also reminds me of another point that they mentioned. They mentioned how this healthcare system will be funded by the Bill Gates Foundation and other charity foundations. Ladies and gentlemen, you're asking charity foundation to fund a population that is essentially capable of paying for itself. 56% of them who do not want to derive funds from charity that are allocated for the most needy. And coming along to my last line of argument, this will weaken the private healthcare companies. Ladies and gentlemen, right now, in America, where the tertiary sector is a major component of the economy, can we really afford, while also overburdening the government with the healthcare expenses, can we really afford to weaken these private insurance companies? Can we really afford to weaken the tertiary sector? No, ladies and gentlemen, we cannot. We cannot afford to allow the government to undergo these additional burdens and also have a sector of their economy weaken. We cannot allow the government to allocate some of their funds onto the people. We cannot allow the proposition policy to come forward whereby they are removing that option of us to resort to either private or state-funded healthcare. And for all those reasons, I beg you to vote for team proposition, the more responsible side of the House, the side of the House that caters to all factors of the population, and the side of the House that is clearly proposed the better policy.
Speaker spoke for 8 minutes 23 seconds.